So how much does a typical healthcare plan cost in Vietnam? So here are some of the benefits you would achieve. So let me tell you about the healthcare system in Vietnam. Always the first thing we ignore is our health, but that is critically important, especially when you're moving to a developing country like Vietnam. So in this episode, we want to talk to you about the healthcare system in Vietnam, the quality of the healthcare system, and also the cost of getting healthcare in Vietnam and what is available. So that's what we'll talk about today. So hello, my name is Ken Duong, and I'm standing here in front of Pasteur Institute. As you can remember, during COVID, I went here many times and many of the people came here to get their vaccines. And this is one of the research centers called the Ho Chi Minh City Pasteur Institute. So with over 13 years of experience as a global immigration attorney, helping people travel, live, and work around the world, including Grenada, Portugal, United States, and many other countries, today we want to be able to share with you a video about the healthcare systems in Vietnam. But before we get into that video, if you like this video and other ones, make sure you like our Facebook page, subscribe to our YouTube channel, and click the bell for notifications. So let's get started on the healthcare systems. So let me tell you about the healthcare system in Vietnam. It has gone through a dramatic transformation since 2014, and now through universal healthcare, 80% of all Vietnamese have healthcare coverage. Also, it is a decentralized system whereby the government or the Ministry of Health will work with the provinces, the districts, and then the communes from top down in order to provide healthcare. So, what can you expect to be covered for by Vietnam's public healthcare system? Inpatient and outpatient care, consulting fees, pathology, medications, pregnancy checkups, transport supports for vulnerable people, eyesight treatments for children under 6, treatments for suicide cases or self-inflicted injuries, sexually transmitted diseases, birth defects, and inborn diseases. To make sure more people can afford to access this care, there are two types of healthcare cover available in Vietnam, which are both managed by the Vietnam Social Security System, or VSS. Compulsory Social Security cover. This applies to all workers on permanent contracts of more than 3 months, as well as several other categories, including children under 6, financially unstable people, students over 90 years old, and war veterans. Voluntary health insurance. This applies to anyone not covered by the mandatory scheme, such as self-employed and informal workers. Compulsory health insurance contribution rates amount to 4.5% of income, with 3% provided by the employer and 1.5% by the employee. Like in most countries, the system has a public system and a private system of different healthcare facilities at the provincial level, the city level, the district level, and then the commune level. And it's a two-pronged approach. One is the prevention side, similar to the CDC of the United States or Center for Disease Control. Second one is the acute system, whereby treatment after they've been diagnosed or with certain diseases. So prevention versus acute care. So expats are mostly free to buy their insurance. However, they may have compulsory insurance as well, similar to Vietnamese if you're working for a Vietnamese or foreign company under a Vietnamese contract. But like similar to many of the insurance policies, it's not enough to cover the entire expat's family. Therefore, most expats in Vietnam will also buy additional coverage or extend their international coverage from their home country. Number 2, the quality of the healthcare in Vietnam. To be perfectly honest with you, if you come from the United States, Europe, or some of the more developed countries, you will see that the Vietnam healthcare system is not on par with the international standards. But that's fully understandable because Vietnam is a developing country and doesn't have the similar infrastructure necessary in order to provide very severe illnesses or prevention. So that is understood. However, it's still a very good healthcare system with very high quality. Public hospitals in Vietnam are usually not funded enough and not very well equipped, meaning waiting times can be often frustratingly long. You will generally find that levels of quality and availability would dip even further in rural areas. And in some of the more remote parts of the country, public healthcare is almost non-existent, and you would need to travel a while before finding a hospital. However, new hospitals have been built in very smaller cities, including Nha Trang, Vũng Tàu, and Phu Quoc, and there are now 2 internationally accredited general hospitals, one in Hanoi and the other in Ho Chi Minh City. So before we get into the different healthcares available, we want to talk about what options you have if you become a Vietnamese citizen and how to become a Vietnamese citizen through our Descent program or through an investor program. Through the Descent program, if you were born in Vietnam or both of your parents were born in Vietnam with Vietnamese citizenship, then you can get your citizenship and apply under the Vietnamese local program or the expat program for your healthcare insurance. The second available option is as an investor. Investing into Vietnam, you can potentially get a temporary residence card, work permit, and be able to stay longer term and access the public healthcare system as well as a private healthcare system. So those are options you have available, but let's get into the private healthcare system details now. So what does the private healthcare system look like in Vietnam? So here are some of the benefits you would achieve if you were in the private healthcare system, such as more private hospitals in the network, shorter wait times, less language barriers because of the staff and the doctors being able to speak English, and then you also have better coverage. However, with that better service comes with a higher price. Nevertheless, most expats will opt to do the private healthcare system because they want to make sure that their families are fully taken care of. So how much does a typical healthcare plan cost in Vietnam? The typical plan will cost roughly about $7,775. As an individual, you're looking at roughly about $4,000 per year. But as an entire family, you're looking at about $11,500 for the family. What are some of the factors that will determine the cost? One is the provider that you're using. 2 is the plan or the coverage that you're using. 3 is the location. Are you in a big city or a small city? 4, how much people are being covered in your plan? And 5, if you're also looking to have international coverage as well. So those are the determining factors on the cost of your healthcare plan. To give you an idea of how much you can expect to fork out for different treatments, here are a few examples. Consultation with a private GP between 900,000 and 1.6 million VND, or 38 to 69 US dollars. Keep in mind that international clinics will be more pricey. Consultation with a private specialist between 1 million and 1.7 million, or $43 to 73 US dollars. But again, expect international clinics to charge more. Consultation with a private dentist. A routine consultation is usually free, but can be up to $10 in some facilities. The placement of a dental crown varies between 800,000 and 7 million VND, or around $34 to $302, depending on the type of crown. Hospital expenses at a private hospital costs vary considerably, depending on the medical condition being treated and the chosen hospital. As the national healthcare system in Vietnam is still in progress and developing, we would recommend that you have both the local insurance with your company, but also maintain your international expat insurance, either with your home country or with an international healthcare provider in Vietnam, because health for your families is critically important. Our team of legal and business experts will help you find and work with the right insurance and the right hospitals and healthcare system to make sure your family is taken care of. And that is what we aim to do. So make sure that you reach out to us. And as always at Duong Global, thank you very much for watching this video. Make sure that you like Facebook page, subscribe to our YouTube channel, comment below of other healthcare systems that you've used before, maybe in other countries or in Vietnam. And make sure that you click on the bell for all notifications of upcoming videos on how to live, work, retire, and spend your time in Vietnam. Thank you very much, and I'll see you on the next video.